Reshma is a wastewater surveillance epidemiologist with the Arizona Department of Health Services. She completed her Bachelor's of Science at the University of Massachusetts and a Master's of Public Health in Applied Epidemiology and Biostatistics at Boston University. Prior to joining ADHS, she worked as a research coordinator too at the University of Massachusetts Medical School, where the research focused on genetic, epidemiological, and behavioral foundations of macular degeneration and macular dystrophies. During her time at Boston University, she worked with the Nepal Public Health Foundation to look into pesticide exposure and pregnancy outcomes in agriculture-based areas.
I'm going to go ahead and share my screen. And can you all see my screen okay?
Yeah, we can see it.
Okay, that's good. Thank you, Corey. All right. Let me go ahead and get started. So as Corey mentioned, my name is Reshma Neupane, and I'm the wastewater surveillance epidemiologist here at Arizona Department of Health Services. So my presentation today will focus on the status of wastewater surveillance here in Arizona, and I'll be sharing about the current wastewater efforts being done at the state, talk a little bit about our partnerships, some of the challenges we're facing as this is a new and evolving field, and lastly, what the future looks like for wastewater surveillance here at the state. So let me begin by providing a little bit of introduction to wastewater and wastewater surveillance. So what do we mean when we say wastewater? So wastewater, also known as sewage, includes water from household use, so toilets, sinks, showers, basically water that contains human feces, but can also include rainwater, stormwater, and water from other household usage. So looking at the screen right here, so I'm going to briefly share the flow from the sample collection to making public health decisions with the help of wastewater surveillance. And I'll focus on COVID-19 as that is what we're testing for, and that is our current focus. So wastewater utilities collect samples from sampling locations, and samples are sent off to the testing laboratory. Once at the testing laboratory, they test for RNA from SARS-CoV-2 with samples collected from wastewater. The data then is uploaded to a database or a wastewater surveillance system, which kind of stores or houses all the wastewater data collected from our counties or cities in Arizona that are participating in wastewater surveillance. And this allows public health departments to kind of keep track of COVID-19 trends, monitor those trends, and prevent further spread of the virus within the community. So now I'm going to talk about the national surveillance program we participate in here at the state. So we have National Wastewater Surveillance System, also known as NEWS. So it was launched by CDC in September of 2020 in response to COVID-19 pandemic. NEWS was developed to kind of coordinate and build the country's capacity to track the presence of SARS-CoV-2 in wastewater samples that are collected across the nation. And it is also a system for health department-led wastewater surveillance for SARS-CoV-2, and it's broken down into two major testing areas. So first is the epidemiology and laboratory capacity testing. Here, CDC awards funding to the state in order to conduct wastewater surveillance. And second, we have CDC commercial wastewater testing. So CDC awards contracting labs to conduct wastewater testing. Currently, they're collaborating with BioBot Analytics, and this funding was, initiated to assist states in expanding the wastewater program, surveillance program, and to conduct testing and sequencing of wastewater samples. And lastly, a support element of NEWS is rapid wastewater data integration, analysis, visualization through CDC's Decipher platform. So Decipher is basically a cloud-based data integration and management platform. So kind of like an umbrella platform where, it kind of houses a few different databases, so NEWS being one of them. So now I'm going to talk about, Arizona's wastewater surveillance program. So what is our goal? What are we focusing on? So our current focus is on SARS-CoV-2 at the community level. However, we are now thinking beyond COVID and looking into other pathogen targets that can be tested in wastewater. But at the same time, we want to ensure we think about making the data that we collect actionable. And I'm going to talk a little bit more about this in just a bit. Our goal with wastewater surveillance is to provide early warnings to our public health partners for situational awareness and mitigation measures, and make sure wastewater surveillance is that additional tool that they can utilize within their surveillance system. And second is to develop tools that can be utilized by our public health partners as an aid in decision making. And also, as I mentioned at the start of the presentation, that wastewater surveillance is a new and evolving field. Therefore, our goal is to help educate the community and public about wastewater-based epidemiology. However, I do want to mention that, everybody participating in wastewater surveillance is really learning from each other. I know at the state, we're learning from our other state partners, CDC and other partners here in Arizona. So let me talk a little bit more about, how wastewater surveillance got started in Arizona. So how did it all begin? So back in 2018, City of Tempe started testing for opioids in wastewater. They collaborated with their police and fire department and really kept them in the loop for opioids testing efforts. They also developed their dashboard to kind of share what's happening in their community in regards to opioid level with their stakeholders. I think they've, really laid a great foundation for opioids testing in the wastewater at the city level. Then in 2020, City of Tempe started testing for SARS-CoV-2 and wastewater in response to the COVID-19 pandemic and paused their opioids testing. And also in 2020, ADHS collaborated with University of Arizona in wastewater testing for SARS-CoV-2 in the dorms, which was a very successful pilot study that was conducted. And then towards the end of 2020, CDC launched the National Wastewater Surveillance System to begin wastewater surveillance efforts nationally. And in 2021, ADHS received the epidemiology and laboratory capacity funding and expanded their wastewater team. And since then, we have been, really working on developing and expanding wastewater surveillance program in Arizona. So now I'm going to talk about, where we're doing the testing, who are we partnering with, and how that data gets to us. So in total, we have 30 sampling sites, and within these sites, we have sites from Yuma, City of Nogales, and there we're also collecting wastewater from Sonora, Mexico, sites from Maricopa, Pima, La Paz, and Mojave. And then from the sites from Yuma and City of Nogales, so they collect those samples, send it off to U of A lab for testing, and I know U of A kind of forwards some of the sample to TGen for sequencing, and then that data that's retrieved is shared with WICIDA, which also stands for Yuma Center of Excellence in Desert Agriculture, and they're one of our recipients for the ELC funding, and then they kind of shared that data with us. And I do want to mention that WICIDA Lab has purchased their own sequencing machine, and I know their plan is to kind of start sequencing samples in the near future. And for City of Tempe with Maricopa, so they collect their samples, send it off to ASU lab for testing and sequencing, and then that data gets shared with City of Tempe, which is another recipient of the ELC funding, and then they share that data with us. And I know recently City of Tempe has been kind of collaborating with TGen as well for some of their wastewater efforts. And some of the other sites from Maricopa, Pima, La Paz, and Mojave, they are participating in the CDC commercial contract testing with BioBot. So BioBot coordinates the testing, sample collection, and then sharing the data to CDC directly. So that was an overview of the testing partners. So what happens once we receive the data from our partners? So once they share that data with us via secure file transfer, currently I do have to mention reviewing and uploading of the data to news is happening all manually. However, once we are ready for making those automated submission export, and when they do share that data with us, it will get uploaded to our database. Then we are going to upload it to news, and then we'll also work on exporting some of the data from news to ensure all of our data gets into our database, because there are so many different entities conducting the testing, and then so that once all of that data is within our database, we can conduct analyses and eventually display that data onto our dashboard. And our database is now ready to use, but we're still working through, developing some of the scripts to automate some of the submissions, exports, and we're actively working with our Tableau team to develop wastewater dashboard for Arizona. And I do want to kind of talk about some of the how our partners are disseminating that data. So if you can see that on the top right here, we have a wastewater-based epidemiology level of concern table. So that has a concentration threshold, which correlates to a level of concern, and then that correlates to a response action. So this was developed by YCEDA, U of A, in collaboration with ADHS. So our Yuma County Health Department really utilized this, especially during the pandemic, to make those response actions for wastewater samples. And then right below that, we have City of Tempe's dashboard, public dashboard, and then they've really done a great job creating that, and then keeping all their stakeholders in the loop on what they're seeing in regards to COVID, SARS-CoV-2 in their wastewater samples that they're collecting. And then I did make a note here that wastewater data can be useful when used in conjunction with syndromic data, such as hospitalization, deaths, vaccination rates, healthcare utilization. Just because we've now moved into this different phase in this pandemic where people are utilizing at-home test kits, we're not getting that big volume of clinical data as we used to. So it's definitely helpful to kind of look into other indicators along with the wastewater data. Right. So this is definitely just work in progress, but I just wanted to share with you all, what we've been kind of working on here at the state. So we're working on developing this dashboard for our internal public health partners, and including some of the trends that we're seeing, some of the sites where our sites are kind of located, but we're also talking about that map right there. We're also working with our GIS team to kind of make those maps more accurate, granular, including boundaries information, so that we're showcasing more accurate data. And then also thinking about how we can kind of incorporate some of the clinical data, some of the variance data. So this is something definitely work in progress. Probably something we might update on some of the other metrics that we're still thinking about. But just wanted to briefly share. This is what we're kind of working on right now. So now I'm going to talk about, collaboration with our partners. How are we maintaining that relationship? So we've started a community of practice for our partners that runs every month. This is just to provide them a platform to kind of learn from each other, collaborate with each other. It just gives us an opportunity to also here at the state to learn from our partners, to see what they're doing, and also helps us be aware of some of the resources and tools we need to develop at the state level. And second, we have started also a data and communication work group meeting, which is a smaller group where we talk heavily on wastewater data, how we want to utilize the data, and also, work together on the dashboard that we're developing. So we're really incorporating some of the feedback and suggestions that we receive from our partners. And next thing is we're really trying our best to kind of check in with our utility partners. They do this ground level work of going out there, collecting those samples, and we really want to thank them for the work that they do and the contribution they're making to the public health. And we are also, conducting site visits. I know it's really tough right now that we've kind of moved into this virtual world, but we have been trying our best to kind of see them in person, meet them in person. And here's some pictures that I kind of shared from our recent site visit to Yuma County. So like I mentioned earlier, now that we're thinking beyond COVID, some of the targets that we can, non-COVID targets that we can think about and expand to. So I just wanted to kind of share some of the kind of updates on that. So monkeypox testing is kind of being thinking about by BioBot under that CDC commercial contract. So I know they haven't started the testing yet, but I know they're going to be starting that soon. And in regards to polio testing and wastewater, CDC just kind of released some of their recommendation and guidelines. So they recommend that we conduct polio testing in wastewater only in the presence of a clinical case of paralytic polio. And we have some of our wastewater center of excellence. So one is Colorado State Health Department and Houston Department of Health, and they're starting some work groups for monkeypox and polio testing in wastewater, and that is intended to begin soon. And here I just kind of listed some of the targets that are being tested and some of the interests that our partners have. So the hospital-associated infection targets, Candida auris, influenza, opioids. But I think I really want to kind of emphasize that it's crucial to think about some of the public health actions prior to testing for these pathogens in wastewater. I think therefore we have been working actively here on creating like a master target list to assist us on figuring out how and where we can prioritize wastewater testing efforts at the state. So what do we mean by when we say public health actions? So just to give you a brief examples. So I know at the start of pandemic, we were kind of mentioning, wear a mask or practice social distancing or, stand up some vaccination or testing clinics. But I think, now that we have kind of moved into, shifted to a different phase, we want to think about those individual household prevention behaviors and community level prevention strategies. So it's really important to kind of think about, we need to make our response actions applicable to kind of where we stand in the pandemic, and something similar we should consider for our other pathogen targets as well. So some of the future of our wastewater surveillance, our plan is to conduct wastewater testing in-house, expand to additional sites, expand to other pathogen targets, really work on developing those proper testing methods and mitigation measures. And like I mentioned before, this wastewater field is very new and evolving. So there are some challenges that we face. Initially, when we started wastewater testing, our state lab did not have the capacity to bring the testing in-house, but now they are very interested and they're collaborating with the Colorado State lab to kind of discuss those logistics and resources. And we're also, figuring out the data flow, cadence of data being received. And, just because this field is progressing very, very rapidly, it's challenging to quickly identify those mitigation measures and developing those testing methods. And also, I think, keeping our utility partners engaged and interested in the program is also very challenging. And I do want to wastewater surveillance would not have been possible with any of our partners. So I would really like to thank our utilities who really do those ground level work going out there to collect those samples, lab partners, academic partners, our local public health news team, and our internal ADHS team. And thank you all so much for your time. And this is our small wastewater team in this virtual world. We couldn't get a picture of us all together. So we have some solo pictures. So we have Julie Weiss, who our program manager, Jasmine Johnson, who's our program project specialist, Khalid Khoury, who's our genomics informatics and analyst, and then there's me. Thank you all for listening to me today. I'm not sure if I left any time for questions, but here's my contact information and our group email. So feel free to reach out to us with any questions or suggestions for us.
Thank you so much, Reshma. I always love hearing about this kind of stuff. I think it's just so interesting. Like, who was the first person to think of this?
That's true. All right, TI. Let me see.